Hi everyone, Jack Cush. I'm here on the convention floor at ACR22, Philadelphia. The morning has just begun. I just came out of the year in review, a popular session, so popular they had an overflow room, which means they must have had 5,000 plus people viewing this thing. Two presenters, a clinical and a basic scientist, Dr. Carol Langford from the Cleveland Clinic and Dr. John Varga from the University of Michigan did a stellar job. Carol put out the call for what was the highlights of this year as far as the year in review, the best stuff in the clinical sciences. She had a few. One, the Gloria trial, a pragmatic study of steroid use in RA patients over the age of 65. Second was, as you would expect, the oral surveillance study, tofacitinib versus a TNF inhibitor and its safety woes. The mirror study she highlighted, which is the methotrexate being added on top of pegloticase in refractory and difficult to treat gout patients. And then of course the new indication of something we've been using for many years, the FDA approved this year, the IVIG approach to treating patients with dermatomyositis. Again, we've done it for years, but now we have an FDA indication. We presented that data last year at this meeting. The other big thing, it's in press, is the CAR T-cell directed therapy at CD19 or B cells. A great paper from Georg Schett showing how you could take train wreck refractory SLE patients who failed everything and give them these CAR T-cells and they all went into remission off of their biologics. Next was she closed with pre-exposure prophylaxis, something that we should be considering in our patients who are immunosuppressed, especially those on rituximab, as a way of keeping them safe, even here at the tail end of the rituximab pandemic. She had others. John Varga dealt with the basic science side. He led with, and he also received input from colleagues and culled what he thought was the most important. A few from him was the report of a TLR7, a toll-like receptor 7 variant that leads to a higher susceptibility for lupus. By having this variant in TLR7, you have a gain of function sensitivity to nucleic acids, therefore leading to this immunogenic response, more B cells, more plasma, cytoid B cells, etc., leading to lupus. It's sort of discovered as a human mutant, but then reproduced via CRISPR technology in animals. Really exciting. Also, the increased expression of CD38 in lupus patients was found and also found to be associated with lupus patients with infection. He sort of went and just sort of discussed how that happens. Really interesting. Another paper on immune activity in non-lesional lupus skin that's similar to lesional lupus skin, saying that even though the skin isn't involved by looking at it, by seeing a malar rash or a discoid rash, there's a lot going on in the skin of patients with lupus. And then lastly, he had others, but he talked about a vaccination-based approach with immunotherapy to target pro-fibrotic cells, a way of treating these conditions like scleroderma, ILD, etc., where fibrosis is a big problem. A great session, really informative, the year in review, another knockout here at ACR. Tune in for more.